Good afternoon, everyone. I'm Eric Nestler, Dean for Academic and Scientific Affairs at the Icahn School of Medicine at Mount Sinai, along with Dr. Marta Filazzola, Dean of the Graduate School of Biomedical Sciences. It is our great pleasure to welcome today's graduates, their families, and friends to our fourth Masters-Only Commencement Ceremony. Our graduates today represent diverse fields of inquiry spanning public health and healthcare leadership, biomedical and clinical research and informatics, biostatistics, and genetic counseling. Some of you will be continuing your graduate education, but most will be heading to jobs in the healthcare sector so that your work can have real-life impact immediately. Your influence has already been felt locally and globally during your time at Mount Sinai. Here are just a few examples. One of today's graduates worked at Utah's Department of Health, where he uncovered an outbreak of Group B streptococcal infections in newborns in nurseries across the state. He found that state guidelines for prevention were not being followed, which led to statewide improvements in care. Another master's graduate served as chair of the Access to Care team at EHOP, East Harlem Health Outreach Partnership, a clinic led by Mount Sinai students that provides free health care to uninsured individuals in our local community. In the course of 1 year, our student connected over 100 students with more than 200 specialty care appointments, and she established a pathway for EHOP patients to receive additional specialty care not previously available to them. All told, our master's students had another successful year with dozens of publications in top journals and dozens of presentations at national and international meetings. You are an impressive group. You make Mount Sinai very proud with your many accomplishments. I'd like to talk briefly today about artificial intelligence, or AI, something that will influence all of your careers. AI is a topic that is everywhere in the news, an approach that is likely to change all of our lives, but especially our professional work in the healthcare and biomedical sciences industry. According to Webster's Dictionary, AI, also referred to as machine learning or deep learning, describes a machine simulating the learning and problem-solving capabilities of the human brain. I'm a neuroscientist by trade. I'm particularly interested in that aspect of AI. Some say that true AI, where machines operate completely by themselves, does not yet exist, and that we are currently in an age of augmented intelligence, where humans use computers to boost their work. In my view, augmented intelligence is a far more accurate term because today, humans are pulling the strings behind all computers. There are numerous ways in which augmented intelligence will improve healthcare. Mount Sinai's health system is already using AI to help identify, for example, which patients in the hospital are at risk for falls, which babies in the newborn nurseries are at risk for infection, to target those individuals for preventive care, and we are already seeing improved outcomes for those efforts. Radiologists and pathologists are increasingly using AI to analyze X-rays, MRI scans, tissue sections to more accurately and consistently diagnose disease. Just a year ago, the FDA approved the first use of an AI device to help diagnose, in this case, diabetic retinopathy, an eye problem with diabetes. And we expect many such approaches to be approved over the next several years. Surgeons at Mount Sinai and elsewhere are increasingly using computer simulation methods that overlay MRI scans with arteriogram images onto the surgical field when they're in the operating room to help them guide through the complex anatomy of a patient's brain or other organs. And we all carry around smartphones or other wearable devices that keep record of our activities, smartphones, our speech patterns, which will provide doctors and other healthcare providers with invaluable information. Augmented intelligence focused on omics, genomics, proteomics, and the like is being used to derive new insight into the molecular mechanisms of disease, and we're beginning to see dividends pay off particularly in cancer, immunology, and heart disease, with respect to treatments targeting an individual person's specific pathology, process that we now call precision medicine. We're rapidly approaching the day when everyone will have their genome sequenced, and in combination with other tests on blood, urine, maybe even spinal fluid, identify people at risk for disease and institute preventive treatments. Already we estimate that about 10% of us walking around, if we had our genome sequenced, that we would have an actionable genetic piece of information, that some difference in DNA sequence that prompts a specific preventive treatment or improved surveillance. And that number is just going to increase in the years ahead. And finally, we expect these innovations enabled by augmented intelligence to empower individual patients to increasingly manage their own health care, a long-term goal of public health, which we think will be facilitated by these approaches. Mount Sinai has been a leader in the application of all of these computational approaches to science and medicine and public health, and we are reinvesting to continue to help drive the field. Construction will begin this fall on the new James Center for Artificial Intelligence and Human Health. We will be creating close to 60,000 square feet of space to house these various efforts across many departments and institutes, and look to recruit 30 new faculty who will join existing teams in advancing the use of augmented intelligence in understanding disease mechanisms and improved diagnosis, treatment, and prevention across all fields of medicine, an effort that will greatly augment our master's programs in future years. However, we have to be cautious with these advances. Despite the enormous potential, your responsibility, our responsibility, and particularly your responsibility as future leaders in healthcare, science, and delivery, is to provide the healthy skepticism that is required to ensure that we don't overpromise and that we apply AI advances in a balanced and ethical manner. I've been around long enough, which is just a nice way of saying that I'm old enough, to have seen many waves of hype, and there is no question that some of the benefits of AI are being oversold today. As just one example, when I was in medical school about 40 years ago, my professors told us that the promises of molecular medicine, which we call today precision medicine, will rapidly bring transformational advances in the treatment of cancer. But 4 decades later, we're only beginning to see those advances come to fruition. Now, I truly am confident that AI will lead to improvements in healthcare. Mount Sinai and I are betting on it. But those improvements will be gradual and stepwise and will require long and painstaking research rather than providing magical leaps forward. Another fear about AI that's been written about quite a lot is lost labor, that machines will take the place of people's jobs. But I view this more as of an opportunity. All disruptive technologies end sub-jobs but create others. AI-driven diagnostics won't take the place of radiologists and pathologists. They'll make better radiologists and more efficient radiologists and pathologists. We shouldn't oppose the innovations made possible by AI, but work very hard and invest the necessary resources into retraining people so that their skills and income can keep pace in an ever-changing world. The notion of true artificial intelligence, where machines act independently, is more daunting, perhaps even terrifying. Would any of you like to get into a car driven solely by a machine? I wouldn't. Not to mention the possibilities captured by movies or TV shows like Terminator, Ex Machina, Westworld. But again, the way to approach these very real ethical concerns is not to forestall progress, but to ensure the advances we make are safe, secure, and private. Scientists and healthcare providers must work hand in hand with people in industry, government, and nonprofit organizations to guarantee that machines make our lives better, safer, healthier, freer, and richer. I expect these scientific and ethical challenges to be at the forefront as all of you embark today to pursue your own careers. As you face these challenges, be bold, be creative, always have patients foremost in your mind. I wish you well on your new adventures, and remember, wherever your careers take you, you will always be part of the Mount Sinai family. Thank you.